Did you know that vitamin D is actually a hormone? And look at what can happen when you don't get enough. We're either hurting ourselves or we're healing ourselves. It's your choice. Let's get started. First subject today is vitamin D3, and it must be D3, not the other forms of D, for very important reasons. Now let's get on with the clip.
A nasty flu struck California's Atascadero State Hospital. Dr. John Cannell made an interesting discovery.
I know my patients were exposed to influenza, but none of them got sick.
Why? One reason could be that 30 of Cannell's patients had been given vitamin D on a regular basis. That got Cannell thinking more and more about the vitamin's benefits and safety.
Child's never gotten into a vitamin D cabinet and gotten poisoned. That's happened hundreds of thousands of times with Tylenol or aspirin or other things.
Medical writer Bill Sardi says if vitamin D were a drug, its benefits would make it the most popular ever.
Because we're talking about diabetes and hypertension and bone diseases, osteoporosis and arteriosclerosis and cancer and autoimmune disease, and the list goes on.
Scientists found that list is so long because vitamin D actually regulates cells, systems, and organs throughout the body.
It works by turning your genes on and off, very, very basic function. So that's a very important fact about vitamin D that distinguishes it from any other vitamin. It's a steroid hormone. It's in a class by itself.
A major question and area of controversy regarding vitamin D is sun exposure. So health investigators hit the trail looking for answers. Doctors have observed that where there's less sun, there's more cancer, flu, and even autism. For instance, there's more of these diseases in winter, which has less sunlight. And there's also more of these diseases the further you get away from the equator, because there's less sunlight the further you get away from there.
Even here in sunny California, very few people get enough sun to make sufficient vitamin D in their skin for the best of health.
Down in San Diego, you can make it year-round, but even then, in San Diego, in the wintertime, you have to go right out at solar noon. There's only about a 2 or 3 hour period where you're going to make any substantial amounts of vitamin D.
But wait a minute, won't this possibly lead to skin cancer? Most sunscreen companies provide products that block the ultraviolet B, or UVB, from the sun. Those are the very rays you need to produce vitamin D in the skin.
Now they admit the UVA rays that the sunblock lotions allow to get in are the ones causing the cancer. So they let the one that causes skin cancer in, and they block the one that prevents it.
Statistics show skin cancer rates and deaths have actually risen since the sunscreen campaigns began 30 years ago. Cannell recommends keeping your time in the sun moderate. 15 minutes in a bathing suit during summer is plenty. You don't want to age your skin or cause damage from a sunburn. Not everyone agrees. The American Academy of Dermatology website finds it appalling that anyone in good conscience could make the claim that intentional sun exposure for any length of time is beneficial. Then there's the issue of darker skin, which naturally screens out more of the UVB rays that make vitamin D. Their blood levels of D are about half that of lighter skinned people, making a connection with the diseases that shorten their lives.
Heart disease and hypertension and stroke and cancer are the same diseases that have been associated with vitamin D deficiencies.
So it may not be surprising that vitamin D deficiency affects as much as 3/4 of the populace, especially as winter takes its toll on vitamin D levels. That depletion could be remedied and possibly reduce the need for flu shots.
Vitamin D activates your immune system, causes something to be formed called little peptides that kill bacteria and viruses without antibiotic resistance, without side effects. We can use it in very young infants and pregnant moms.
And not only help fight osteoporosis, but strengthen teeth as well.
Instead of using fluoride to harden our teeth so there's no soft spots where the acids can then eat into our teeth and cause dental decay, we can use vitamin D. It's more appropriate, it's more natural.
And D appears to boost athletic performance.
There's just clear evidence, especially in the German literature, of choice reaction time, balance, muscle strength, endurance, all improve with vitamin D.
Which may explain why senior citizens on vitamin D are less likely to fall and hurt themselves. And cancer? Sardi says in a new book that a major reason not to be so fearful about the disease is vitamin D. A key U.S. study in June found it provided a 60% reduction in cancers.
Canadian Cancer Society immediately told all of their citizens, begin supplementing with at least 1,000 units of vitamin D. American Cancer Society, mum's the word.
In fact, here is video of how vitamin D helps zap cancer cells, like the one to the right of the arrow. But 2 weeks ago, the National Cancer Institute released a study indicating vitamin D doesn't do much against cancer deaths. NCI normally prefers the type of study done in June, but Cannell says this new study fits their bias against vitamin D. Even at that, the new study did show the vitamin's effect on the number 2 cancer killer.
The people with the highest levels had 4 times less colon cancer than the people with the lowest levels. I think that's pretty important.
So what's the best way for you to get the vitamin D you need? Not from food. Even fortified milk provides so little that it's trivial. Taking supplements is a far more predictable source than sunbathing, and the only source in winter for millions. Experts suggest the best daily intake is at least 2,000 units for most kids and 4,000 for most adults. Yet the government recommends only 200 to 600 units depending on your age.
Just the whole thing, when you think about it, is just patently absurd. And the government's been recommending this now for 10 years, and they refuse to change they refuse to even look at the science.
Cannell says he and his wife have taken as much as several 100,000 units for a few days when fighting off colds or flu. His usual daily dose is 5,000 units, a dozen times what the government recommends for him. He finds it a religious connection.
Here the Lord is saying that there's a system that makes this much vitamin D this quickly, thousands of units a day from sun exposure. And here's a government over here saying you only need a couple of 100 units a day. So you can sort of ask yourself, who do you want to believe, God or the government?
Galen Tethrow, CBN News.
It provides a reduction in the risk of a number of chronic diseases. It reduces the risk of fractures, falls, multiple sclerosis. It's important in reducing the risk of certain kinds of cancer, according to observational studies such as breast cancer, colon cancer, and ovarian cancer. We need more clinical trials to establish the appropriate amount, but it also will reduce the risk of type 1 diabetes in children and adults.
Now on to subject 2, turmeric curcumin, the magic spice, with a documentary from endalldisease.com.
Cumin, also known as curcumin, is better known as the Indian spice that is contained in curries, but it has received a lot of airtime over the last couple of years and quickly risen to become one of the most valuable new nutritional supplements on the market. And this is due to all the research which continues to churn out lots of data showing that cumin has tremendous health promoting abilities.
And I want to read something from a publication that when I first read it totally blew my mind, and then I want to comment on it a little bit. At this writing, Medline contains 193 articles on turmeric and curcuminoids. Of interest are 16 articles on these compounds as antioxidants, 34 reports on their role against cancer, 23 on their mechanism in reducing inflammation, 5 scientific articles on their potential to reduce heart disease, and 3 studies on slowing the progression of HIV infection to clinical AIDS. Now, I don't know of anything else on the market that is covering that much ground. That's just amazing to me, that curcumin could affect so many different properties in the body. I mean, that's something that should be like on the cover of Time and on your evening news. There should be there should be like a public announcement on television telling you about the benefits of curcumin.
Turmeric, a spice that can be found in many curries, is showing promise in the prevention of diabetes. Researchers have found that mice that were fed turmeric were less susceptible to developing type 2 diabetes and also showed reduced inflammation in fat tissue and liver compared to untreated mice. Turmeric is also being studied as a potential treatment for pancreatic cancer, colorectal cancer, and Alzheimer's.
Every lady out there would be interested to know about breast cancer. Take 1 million women in America. 660 out of a million will get breast cancer and 160 will not survive. But in India, only 79 out of a million get it, and there's 41 deaths compared to 160. And then when you look at prostate cancer, the statistics for men are about as dramatic. There are 30 pathways to cancer, inflammatory pathways. He says turmeric is able to stop and inhibit all 30 pathways.
All of them.
I said, how does it do it? He said, well, primarily, turmeric shuts off cancer switches. It shuts down nuclear factor kappa B and STAT3. Those are the two main sources of inflammation that lead to cancer.
We live in a culture of inflammation. You know, we have arthritis and bursitis and colitis and tendinitis. Itis means inflammation, so these are all inflammatory conditions. So we could probably talk a little bit about the root cause of some of those inflammatory problems, and it probably comes down to diet and lifestyle, lack of proper foods, and especially eating inflammatory foods, and also lack of exercise. But as far as something that could really be a nice supplement to talking about the proper diet and exercise for an anti-inflammatory protocol, it would definitely be curcumin.
In arthritis, it's great. You see, it's also a COX-2 inhibitor. And for arthritis, it's fantastic. In doing my research, I find out that the pharmaceutical companies, there's your big pharma, has been trying to get the FDA to change the classification for decades on turmeric so they could call it a drug, and then they could manufacture it and sell it to us as a drug. And lo and behold, the FDA, give one to the FDA, they turned them down. They said it's a spice, it's been a spice for 4,000 or whatever years, and it's got a history, and we're not going to change the classification. If they could have gotten it, I'm sure by now they would be touting it as the biggest potential cure for cancer in all the different cancers, brain cancers, everything. It's very inexpensive. I just had a package delivered by UPS about an hour and a half ago with a special kind of turmeric, because I found out that 66% of turmeric is lost in the feces and in the urine.
And here's a peek at a little reality.
I'm the butter queen. We call butter the queen of fats. And butter from grass-fed cows is really the perfect fat. It has the perfect fatty acid profile. It has a perfect vitamin profile, a wonderful balance of A, D, and K. It's full of vitamin E. It's full of very important minerals like iodine and selenium. It has things like choline in it, which is necessary for mental function. It has short-chain fatty acids, which help with digestion, glycosphingolipids, which help with digestion. I mean, it's just a perfect food. And even in the Bible, they talk about the wonderful spiritual benefits of butter. So why are we using these industrial fats like margarine, which are poison, which the animals won't even eat?
You're either hurting yourself or you're healing yourself. It's your choice. See you next time.